My name is Dr. Babalanda Joan Peace Wanyama. I'm from Uganda. I'm a general surgeon by background. Before I came for this program, I was working with Jinja Regional Referral Hospital. That's in the eastern part of Uganda. I got a chance to be part of this program by virtue of the fact that Uganda now is focusing on non-communicable diseases which have become of significant public health importance, and therefore the need to improve our cancer care is being emphasized for now, and therefore I was chosen to come for this program. Uganda currently is experiencing a significant increase in the number of cancer patients. However, we are limited in terms of human resource, equipment, and diagnostic tools. So right now, the government is focusing on building capacity in this area, and therefore a lot is being done. We have a National Cancer Center, which is based at the National Referral Hospital. However, we don't have any satellite cancer care centers. So really, it's a big challenge for patients, especially those who are country who have to travel long distances to come and seek medical care after they've received a diagnosis of cancer. So my being able to train in surgical oncology is going to go a long way in addressing some of the gaps. For instance, we have specialists in medical oncology, we have some specialists in pediatric oncology, we have some specialists in gyne oncology. However, there's been a gap in surgical oncology. And yet cancer care is basically that uses the approach of multidisciplinary care. And without surgical oncology on board, it becomes a challenge. So it has been a very big gap that has been facing the Uganda Cancer Institute, and therefore my training in surgical oncology is going to go a long way in addressing this gap. In my country, the level of awareness about cancer is, I can say it's moderate. However, the challenges that are being faced are mainly in screening. Much as the burden for cancer is high, most of the patients have got at an advanced stage, largely because screening of cancer is lacking. And therefore, I would recommend that the government emphasizes more. My hospital is one of the centers that has been earmarked as a cancer care center. Like I said, we only have one cancer care center, and that is at the National Referral Hospital. And this has proved to be a big challenge, especially for patients who are coming from outside the city. The level of awareness in my country is adequate. However, the challenge that the people in my country are facing is lack of adequate screening tools. The programs in place for screening are so limited, so patients are presenting at advanced stages. And as such, the cancer care outcomes are very poor. The main challenges that oncocare faces in my country are challenges of screening tools. The diagnostic tools are a very big challenge and very expensive, if any are available. And also, of course, the human resource is limited with just a few specialists in oncology, and yet the patients are very many. So basically, it's cancer care is an area that is just coming up, and the Ministry of Health is now focusing on building capacity in that area. Most of these patients who present with a diagnosis of cancer outside the city are initially managed by general practitioners, and really by the time they reach the tertiary institution where they can receive specialized care, their conditions have advanced. And therefore, the challenge that the specialists are also facing is that most of the time when the patients present, it's a bit too late. So I would recommend that more emphasis is placed on improving on screening programs and also availability of the diagnostic tools as well as the treatment, and having increased satellite treatment centers to be able to handle these patients nearer home. I would like to take this opportunity to thank Merck Foundation Cancer Access Program for this opportunity they extended to me and my country to have me trained in surgical oncology for a period of 2 years. And as such, I've been able to acquire so much skill and knowledge in this area. And therefore, I believe that with what I have gained from the training in this program, I will be able to improve on the outcomes of cancer care in my country, as well as reduce on the medical tourism that has been going on. A lot of patients have been having to travel out of the country to receive especially surgery for cancer. And now with the training that I have received, I believe that most of the patients will be able to receive the care from Uganda. I would also like to take this opportunity to pledge my support to my country and be able to train the other doctors as well, so that generally we can improve on the surgical care of cancer patients. I would like to thank the National Cancer Institute, Cairo University, for all the training that I have received. And this goes without challenges. There were quite a number of challenges that I faced during my training. However, I believe that they can be improved. For instance, the issue of language. Language has been a very big barrier in the training program. And I hope that this can be addressed over time, especially considering the fact that a lot of trainees will be coming from sub-Saharan Africa, where Arabic is not their language. But generally, overall, the program has been good, and I would like to thank Cancer Institute, the National Cancer Institute of Cairo University, for all the training that